everyone, Niki here at the Drug Boss Show. Today we're joined by Dr. Matt, a general dentist out of Northern Oklahoma Dental Associates in Blackwell, Oklahoma.
Thank you very much. Long name. Long name.
Yes, it is. It's a tongue twister too. I'm pretty proud of myself that I got that right.
Pretty good. Killed it.
So they're probably wondering why I'm wearing scrubs and not Drug Boss Show shirt. Well, I was actually a dental assistant for 10 years before I did this fun gig. And I wanted to feel at home.
Oh, well then here. I went ahead and, got you a little bit
Oh,
there.
how sweet of you, Matt. Do I look more official now?
Totally official.
I can't really see anything, but I think I feel at home now that I have all the get up on. Okay, I'll take these off. So let's get down to business, Matt.
Okay, let's do it.
Today we are going to talk about oral hygiene and some of the things that folks out there are putting into their system that could be bad for your oral hygiene.
Okay.
Unfortunately, there are a ton of folks out there that love those sugary drinks, energy drinks. Those are really bad. What would you recommend for those folks that just are like, I'm not giving these up, I'm going to continue to consume them? What would you say?
I mean, I understand totally, especially people that are driving around all the time. They got to stay awake. They got to be there, be there on the job and be with it while they're driving around in their trucks. You don't have to give them up. It's not good to sit there. The biggest thing is, especially because I've seen it tons of times. Whenever I go stop at a travel stop and everybody has those Bubba kegs, it's probably about 64 to 72 ounces, and they'll go fill it full of pop because you can't stop all the time. I totally get that. And then they'll go sit down in the truck and they'll sip it all day long. So that's actually the worst thing you can do. It's okay to drink pop. It's okay to drink energy drinks. The biggest thing is you don't want to sip on it all day long, because the bacteria that live inside of your mouth, whenever you feed them sugar, that's whenever they start growing and multiplying, and then actually what they do is they take sugar and then they make acid. The acid they make is what wears away the enamel of your teeth, and that's what starts cavities in the first place. So if you're constantly taking sips of everything and constantly bathing your teeth with sugar, they're going to stay active all the time. Now, if you were able to sit down there and you just got, instead of getting, the large Red Bull, maybe you get, the smaller one, drink it pretty fast, and then just drink some water afterwards. That'll wash everything off of your teeth. You still get the energy that you need to drive, but then you're also, lowering the sugar amount that's in your mouth at the time.
Good advice. So on that same token, when it comes to snacks that these people are picking up at these stops, what would you recommend that they go for, and then the snacks that they should avoid? Okay.
Well, the biggest thing is the higher the protein content in it, the better. Because whenever you're eating stuff like beef jerky, even pork rinds, stuff like that, you have a lot of protein that's getting in there. And the protein doesn't stick to your teeth, and also isn't broken down by the bacteria to make cavities and stuff too. But if you're eating things like, potato chips, that's one of the biggest ones. If you eat those, there's enzymes inside your mouth that break things down pretty fast, that turn it in from a starch into a sugar. So you want to stay away from those as much as possible. You also want to stay away from, any really high sugar content like gummies, things like that. You want to stay away from those too, because it's just the sugar load you're putting in all the time. Candy bars, same thing. You can eat a candy bar though, it's just the same thing. Drink water when you're done.
So what snacks are good for them?
The best thing is string cheese is great. Like I said, pork rinds aren't bad for you at all. Beef jerky is probably one of the best snacks that you can do. Things like that are where you want to be.
Awesome. Right. So what are the repercussions of bad oral hygiene?
So one of the biggest things is going to be cavities you can end up getting. Over time, you're going to end up, the cavities start off pretty small, and if you're not going in regularly to get things checked up, or you're not taking care of yourself, then they're going to end up getting a lot deeper, and then you're going to have a lot of tooth pain, get up with abscesses and things like that as well. And then, of course, you don't take care of your gum tissue. Next thing you're going to do is lose a lot of the bone that's around a lot of your teeth that are there, and then they're going to end up getting wiggly and loose and have to lose them anyway.
Well, we don't want that.
No.
So how often would you recommend individuals get their teeth cleaned?
So at least once every 6 months. Now, some people so twice a year in total is the minimum they need to be going in to get things checked out. Some people, though, if they do have active, periodontal disease that's going on, they may have to come back more often. So, depending on the hygienist that you're working with and the dental professional that you're seeing, then what they'll end up doing is tell you to come back. Sometimes you have to come back every 3 months.
Gotcha. So if anybody's interested in stopping to see you, Dr. Matt, where can they see you at?
We're off exit 222 in Blackwell, Oklahoma, so north central, and then just stop by anytime.
So if you're interested in stopping by to see Dr. Matt and his staff, rumor is they are the friendliest staff in town. So make sure you are keeping up with your oral hygiene. It's very important. And thank you again, Matt, for all your expertise.
No problem. Thanks for having me.
And we'll see you on the next Drop Off Show.
See ya.